My name is Robin McKinney. I'm the director of the Maryland Cash Campaign, and I've known Liz Bobo since 2007. I met her during our very first legislative session when we were pushing legislation to license paid tax preparers, and she was one of the first people that I went to meet with. When I first met her, I was actually a little nervous. It was my first legislative session. I hadn't done any policy work before, and I was so relieved to meet her because she was so open and friendly, but also very honest and really thoughtful, and asked a lot of questions about what we were trying to do, about our organization, and she just sort of got our mission right away, and really understood that, financial security for working families, for low-income families, is very different than what it looks like for more sort of higher wealth individuals.
I've known Liz for decades, and we met when she was county council person in Howard County. Beginning then through now, she has been one of the true public health leaders of Maryland. Every issue that involves saving lives, she's been at the forefront in making it happen, from reducing gun violence to reducing teen smoking and underage drinking, and expanding health care. As county executive, she worked with us to make sure Maryland had some of the best gun violence prevention laws in the country. Without leadership of people like Liz at the grassroots level, at the county executive level, it wouldn't have happened. And it wasn't easy for county executives to make statements like that and take on the gun lobby. And she was one of the first to do so, and I tell you, it made a big difference. She loves people. Clear in her relationship with her family and just talking with her, she loves people, and she knows that public health measures work. She's a smart person. When we present her data that a particular plan, increasing cigarette tax, increasing the alcohol tax, licensing hand purchasers, works, she understands quickly and she moves. And she loves people, she's smart, and she's a hard worker. And I was thrilled when she came to the General Assembly and immediately became one of the most effective and eloquent voices for public health and saving lives in the General Assembly.
I think she believed in us. And she basically took a leap of faith. First of all, we did the first community arts assessment in the state of Maryland. Secondly, the Jim Rouse Theater, which was a private-public partnership in a public school, had not been done anywhere in the country. Nowhere. Absolutely nowhere. So we had a performance space to help these organizations grow, so the people weren't going from this church to that street to that bar to wherever to try to find those companies. Liz supported all of that and made that happen.
Gonna miss, seeing her personally down there, and just, missing that voice. There aren't a lot of people that are willing to just stand firm on what's important and not worry about what other people think about it, and be true to their convictions. And we don't have enough people like that down in Annapolis, so we're definitely gonna miss her voice down there.
It's also gonna be sad to not have her voice for public health and for the average person there in Annapolis. But she tells me she's not going away. Her voice will still be heard. So I believe that the Maryland General Assembly will continue to hear from Liz Bobo, which is good for all of us.